Thank you so much, Dr. Uday, and a very good afternoon to all of you. Thank you for inviting me. It's indeed an honor. I'm just going to share my screen now. I do not know how to do it. All right. Hello, everybody. My name is Dr. Jaishree Sharad, and I am a cosmetic dermatologist practicing in Mumbai, India. Thank you, Dr. Durusha and Dr. Uday Thanawala, for inviting me here. I'm going to be speaking about a very interesting and important topic, the skin treatments that people can do during pregnancy. I have no conflict of interest. Now, the basic treatments that can be done are electrocautery or radiocautery, or even snipping or shaving of tiny warts, removal of skin tags, acrocordons, DPNs, or even tiny moles. Now, there's minimal blood loss and there is no kind of energy penetrating into the deeper layers of the body. And what we do is we just do these procedures under local anesthesia. We usually give 2.5% lidocaine, or we apply a 2% prilocaine topical cream. And these two anesthetics are pregnancy category B, so they're considered safe. Now, care must be taken not to use anything which has benzocaine or tetracaine, because those are pregnancy category C drugs. So in short, these are safe procedures. Then there's microdermabrasion. Here we use aluminum oxide crystals or diamond microcrystals. There's a vacuum, which unclogs the pores and sucks out all the dirt and grime. And then there's mild exfoliation with these fine crystals, and just the dead cells of the stratum corneum are exfoliated, and the skin looks nice and radiant, and it's done as a deep cleansing procedure maybe once in a month, and it's considered very safe. Then we have these facials called Hydrafacial or the dermal infusion, wherein you do a gentle exfoliation with the diamond tip and suction, and we infuse these serums, like hyaluronic acid, vitamin E, vitamin C, which are considered absolutely safe. So the patient feels refreshed and, radiant. And especially if they have oily skin or acne-prone skin, then the pores can be unclogged and the skin overall looks a lot more healthier. So this is another safe treatment. Of course, it's done by therapists in the clinic. Then there is microneedling. We do it with a handheld derma roller or with a handheld derma pen, which is battery operated. Now, there is no kind of heat energy or light energy here. So again, it's extremely safe. And these are medical grade stainless steel needles, and they are absolutely disposable, used only per patient. And they're rolled on the skin. And at that time, there is, tiny channels are created in the skin, so you can apply the right kind of serums, like again, hyaluronic acid, vitamin C, certain safe botanicals for brightening of the skin, or even for treatment of pores or fine lines or acne scars. Now, for severe acne scars, we do microneedling, radiofrequency, and lasers, which are not done during pregnancy. So then we have, chemical peels. So if you have glycolic acid, lactic acid, and mandelic acid peels, these are alpha hydroxy peels, which are considered very safe because they cause epidermolysis and desquamation. And they would probably enter the upper papillary dermis or just the epidermis. So they're not even reaching the reticular dermis, and hence they're considered very safe. They're done for glow, for acne, acne scars, fine lines, open pores, etc. Then the other type of peels are, salicylic acid peel, of course, is pregnancy category C, and it's a beta hydroxy acid, and it should not be done. Yesner's peel also is a combination peel, and it does have salicylic acid in it. Trichloroacetic acid, retinol, tranexamic acid, phenol, we know for obvious reasons are extremely unsafe because they will cross the epidermal barrier and they will get into the deeper layers, and they're not safe. Then we have laser hair removal. Now, we use a long pulse diode or a long pulse ending YAG or a long pulse alexandrite laser. Now, laser has a specific wavelength, right? So if it's a diode, it's an 804, and what happens is 810, it penetrates only up to a certain level in the skin, and it cannot go beyond that. So there is no way it should reach the ovaries. However, we are lacking data. There's not enough evidence to support the concept that the laser cannot penetrate the deeper layers, and therefore we do not do laser hair removal during pregnancy. Otherwise, scientifically, it should be a safe procedure. However, of course, a lot of times people do get a lot of excessive hair because of hormonal changes. So it's best that they finish with their pregnancy and then come for laser hair removal. In the meantime, they can opt for waxing, shaving, etc. Then we have, other lasers for cutaneous conditions. There are papers which have shown that CO2 laser is safe for genital condylar matter. Then there are papers showing Nd:YAG laser is safe. And we also do certain lasers for acne and for pyogenic granulomas. And what one has to be really careful about when we're using these kind of lasers is the laser plume. So always use good HEPA filters, and otherwise, of course, it is supposed to be safe enough. Now, there are other lasers that we use for hyperpigmentation. We use Q-switch Nd:YAG and pico lasers. We use erbium lasers for resurfacing, and we use there are skin tightening devices, but there's lack of data. Now, as I said, these lasers do not penetrate, or they don't even reach up to the subcutaneous layer, and therefore technically they could be safe. But it's always better to do cosmetic procedures after pregnancy, because should anything go wrong, we do not want the patient to think that it could have been one of these lasers which had caused it. And of course, there's no data which is going to support the safety of these procedures. So we call it as unsafe. Then there is botulinum toxin. Now, again, botulinum toxin, that is Botox, is not present in the peripheral blood at measurable levels following intramuscular or intradermal injections at a recommended dose. And there are enough papers which have shown, that unknowingly or knowingly, when you've injected botulinum toxin in the patient in the first trimester, the patient has had no side effects, nor has the baby, there's been absolutely normal delivery. But the label says it's pregnancy category C, and so it is avoidable for cosmetic indications. However, we all know that botulinum toxin is given for other conditions like cervical dystonia, etc. Filler injections, again, hyaluronic acid is injected, right on the bone and also in the deep fat layer, and there is no evidence to prove that it is unsafe, which is why it's best avoidable during pregnancy. Then we have, these different type of skin tightening devices, the radiofrequency, the microfocused ultrasound therapy, which may actually penetrate and, the reticular dermis, and it actually reaches the subcutaneous tissue. And there is absolutely no data, and there it breaks down the fat, and there is, there can be fat necrosis. Sometimes there can be, and the fat also, which is broken down, tends to dissipate. So it's better to avoid these kind of procedures during pregnancy. Then we have injection lipolysis, cryolipolysis, laser lipolysis, and liposuction procedures that we do avoid during pregnancy, because again, there is lack of data. Also, patients will gain a lot of weight during pregnancy, so it's best to allow them to deliver and lose your pregnancy fat, and then opt for all these lasers, which are for lipolysis. So again, unsafe in pregnancy. Then there are treatments which are not done at clinics, but are done in salons, but I've just included them for your information. Temporary hair dyes are done they just apply during bathing. Semi-permanent, like henna, will last for about 4 to 6 weeks and are considered safe. The permanent ones, which have paraphenylene diamine, there are not enough studies. It's important not to mix different dyes, and because the effect on the fetus of the end products are not predictable, according to this study by Duarte et al. So it's probably safe after the first 12 weeks of pregnancy. Then you have hair straightening, which is usually, a common procedure, and the product that is used is ammonium thioglycolate, which breaks the disulfide bonds in the cortex of the hair shaft. And sometimes it does give contact eczema. And there's one paper which talks about a correlation between pregnant female and their children who developed acute myeloid and lymphocytic leukemias. And these patients did use hair straightening devices and products in their first trimester of pregnancy. So it is avoidable in the first 6 months of pregnancy. And then finally, you have these depilatory creams. You have hair bleaching, like hydrogen peroxide is used as a bleaching agent. The metabolization is very quick, and so it's considered to be safe. But again, we say better in the second and third trimester. And then you have these bleaching, the depilatory creams, the calcium thioglycolate, sodium, calcium, and potassium hydroxide, which are considered safe. Now, there was a study in rabbits showing a correlation between the thioglycolic acid and low weight fetus without genetic abnormality. So it is always preferred to use these creams in the second or third trimester of pregnancy. With that, I'd like to end my talk, and thank you for your patient listening. And I have these 2 books which are available online. Skin Rules is a bestseller. Thank you.